first we're going to extend his elbow all the way, and it locks in place, and that is a bony infield. So here he is flexing his hip, and this is an example of a soft tissue approximation infield. Here he has his hip extended, and then with a little extra hyperextension, there is tension, and that is a soft tissue stretch. Alright, so we're going to list a bunch of motions and their infield. So elbow flexion, which is a soft tissue approximation. Elbow extension, which is a bony block. Wrist flexion, which is a soft tissue stretch. Knee extension, which is another bony block. Hip flexion with knee flexion, which is a soft tissue approximation. And hip flexion with knees extended, which is a soft tissue stretch. So we're going to perform shoulder flexion while maintaining medial rotation, then lateral rotation, and the lateral rotation has a greater range of motion.
When the shoulder joint performs medial and lateral rotation, the head of the humerus moves in a spinning motion on the glenoid fossa.
So, here he is performing shoulder flexion, and the joint surface is a concave surface. It's moving in the same direction. Ready? At the beginning of the motion, the dot on the elbow is inferior to the dot at the shoulder. When performing shoulder flexion, this is a concave joint surface. At the end of shoulder flexion, the dot at the elbow is superior to the dot at the shoulder. So, when performing knee flexion and extension, the tibia on the femur is moving in a concave motion. During flexion, the proximal dot, this one right here, the green one, moved superiorly, as well as the distal dot. So both distal and proximal dots moved superiorly. So here I'm going to explain some joint movements and whether they are closed packed or open packed. So glenohumeral closed packed is abduction and lateral rotation, and open packed about 55 degrees abduction, 30 degrees horizontal adduction. Elbow is closed packed in extension and open packed in 70 degrees flexion, 10 degrees supination. Interphalange closed packed would be full extension, and open packed slight flexion. The hip closed packed is extension, and open packed is 30 degrees flexion, 30 degrees abduction, and slight rotation. The knee closed packed is flexion and extension of the knee, and open packed would be 25 degrees flexion. And the ankle would be closed packed at dorsiflexion and open packed at 10 degrees plantar flexion, midway between inversion and eversion.